Thanks, Craig, and everybody else for having me on the community call, and thank you everyone for your flexibility in moving around the schedule since I have clinic this morning. But I'm thrilled to talk about a new work group that we're creating in eye care and vision research. And so you can go on to the next slide. So just the talk is it can be really quick, but we'll just as an overview go over the current work group members that we have, primarily stemmed from American Academy of Ophthalmology work group on data standards. I'm going to talk about why we felt like there was a need for a new work group in eye care and vision research, specifically looking at the Odyssey work with the OMOP common data model, some of our anticipated meeting schedule, and also just some upcoming events in our community around the NIH Data Scholar opportunity for the National Eye Institute, as well as a workshop coming up in case there are people on the call who might be interested in joining. So next slide. So right now we have a work group through the American Academy of Ophthalmology that is comprised of several members from different areas. Some of us are in academia, some of us are clinicians, some are researchers, some are from government, others are from industry. So we have, fairly wide range of folks who are in ophthalmology and interested on working on data standards and interoperability. We have done some work around providing, comments for different documents, like through IHE integrating the health enterprise. We've responded to an RFA for commentary for the National Eye Institute around imaging standards. We recently put together an article about trying to advocate for vision-related data elements to be part of the core data for the US CDI, the United States Core Data for Interoperability. So, we're involved in a number of different efforts, and previously we had not been formally, working with Odyssey on OMOP, but several of our work group members from the Academy were interested in doing that, myself included. So the work group would be led by myself and Kerry Goetz, who's at the National Eye Institute and has been working a lot in this space. And we'll be involving all the individuals who are currently in the American Academy of Ophthalmology work group, as well as, looking to see who else in the Odyssey community, might be interested in collaborating or in participating, particularly because there are a lot of interesting areas, I think, for synergy and collaboration for eye care and vision in other spaces. Next slide. So, the reason why we needed, or felt like this was needed, was really that I think all across medicine, there's an increasing interest in, data sharing, data harmonization. A lot of this work is important for advancing AI and big data type work. And right now, unfortunately, our field has been a little bit behind in standards development. There's a lot of gaps, I would say, in even just having on all fronts, semantic interoperability, syntactic interoperability, like our imaging, a lot of the data is very siloed in proprietary devices. And so we are trying to improve upon that and really create more standardized data elements that can facilitate data sharing and interoperability in not just clinical practice, but as well as for research, public health surveillance, and some of these other applications as well. One of our big goals is to try to do some, be able to facilitate data harmonization, right? So the OMOP common data model underlies the All of Us research program, MIMIC database, a lot of these large scale data sets. And in ophthalmology, we've also developed large data sets. In fact, our American Academy of Ophthalmology has developed the IRIS, or Intelligent Research Insight, IRIS, which is a clinical registry, and I believe one of the largest clinical registries out there, but it is not mapped to a common data model, and so it's really difficult to harmonize that data with data that might be available in other data sets. Similarly, we have another large data consortium that consists of several academic ophthalmology departments, and that one uses the EPIC data model, but not a vendor, agnostic model. So we're hoping that by working on, creating sort of OMOP specific data mapping for ophthalmology that and eye care and vision research, that we can hopefully facilitate some of that harmonization with these other large data sets and be able to generate, new insights and how the eyes connect to, other parts of medicine. And that'll be really great, I think. So next slide, please. So we're currently anticipating meetings to occur monthly on our Odyssey Microsoft Teams team. We have kind of a dedicated team now for eye care and vision research. We haven't finalized the meeting schedule, but likely will be sort of in the late afternoon, early evening time point, because we do have a lot of clinicians who are involved in these efforts. And so that kind of facilitates their participation. And we also have people in different time zones. We're trying to balance that as well. So we haven't yet fully, finalized this. And so if you're interested in joining, feel free to reach out to myself or Kerry. My email for Odyssey is easy. It's just baxter@odyssey.org. And we'd be happy to, try to find a schedule that works for the most number of people. We do have a big vision research meeting coming up here in just a week and a half or so, and so we're going to try to talk about the OKRs for the work group and more specifics about the meeting schedule at that time. Next slide. So yes, our initial planned work group efforts will really to start formulating those OKRs, trying to perform a gap analysis for the baseline eye exam. And then we are beginning to engage with some subspecialty societies and special working groups around specific use cases. One that is of particular interest, we already had a group reach out to talk about developing a data model for diabetic retinal disease and updated staging for that. And that's really something, again, that will involve collaboration with other areas, and they're looking at incorporating more like systemic biomarkers and patient-reported outcomes and these other data points that we really haven't looked at in the past because our current staging system is largely exam or photo-based. And yeah, we look forward to engaging with Odyssey and other standards bodies to fill those gaps that we identify. Next slide. I see Kerry's on the call, so maybe Kerry, if you want to talk about the NIH Data Scholar opportunity, that would be great.
Sure, absolutely. So we actually believe so much in this effort at the NEI that we have created a position, a paid position, to kind of help us get ramped up and onboarded with OMOP Common Data Model. So sometime later this month or early next month, I expect this position to be open for applicants to apply. But essentially, we are going to use a collaboration with the NIH Office of Data Science Strategy and the NEI Office of Data Science and Health Informatics to support a data scholar position to help us lead strategic development and be able to just, as I mentioned, get us ramped up with OMOP CDM, take some dedicated effort. As Sally is indicating, she has a full-time schedule. We're all very busy with a lot of stuff on our plates, but we want to make sure that this gets going. So look forward to any input, and hopefully some people on this call will apply for that ad as well.
Thanks so much, Kerry. Next slide, Craig. I don't know, Kerry, if you want to talk about this one as well, since it's partly joined with NEI.
Sure. Yeah, so at the NEI, or for those of you who might not be familiar, this is the National Eye Institute, part of the US NIH. We're also hosting a joint workshop with other regulatory agencies, the FDA and the Office of the National Coordinator, ONC, to develop it's a day-long workshop where we're going to be talking about elements of improving interoperability in imaging modalities and devices, mostly centered around DICOM, but definitely trailing into other common data elements and healthcare standardization. So I don't think the link is here. I'll try to drop it in the chat. As you can see, I'm in the car. I forgot about my child's dental appointment, but I'll make sure I share that with the group so you can register for that event too.
All right. Next slide. I think that's all we had in terms of the set slides.
Yeah, those are all of the slides.
Okay, great. And I'd be happy to take any questions I see in the chat.
There's a lot of puns in the chat.
Yeah. I see one from Patrick on research questions from your vision research work group and evaluate the extent to which some of the general purpose databases commonly used in the Odyssey network can be helpful, or the extent to which missingness associated with eye diseases and related procedures and treatments have to be captured from other sources. Yeah, I mean, I can give a specific example just because in my own research, I have worked quite a bit with the All of Us research program. And for example, one of the common eye conditions that we have is glaucoma. And we have been interested in looking at, as one example, social determinants. How do social determinants influence glaucoma progression? And the All of Us program has been great for that because there is such granular data around healthcare access and utilization, income, education, transportation, all these different things that we don't have readily available in our EHRs as part of sort of routine clinical care. But the phenotype of glaucoma progression has been really difficult to ascertain from All of Us because the eye data are really not there. So, so normally we would look at visual field or OCT, which is optical coherence tomography. It's a form of imaging of the optic nerve. And those are some of the data points that we would look at to determine clinical progression. And that really is not in All of Us in part because of, when you look at it from the data standard standpoint, we don't have a lot of great standardization of data elements of those imaging metrics themselves. So not all of them have LOINC codes as an example. And the other is just that a lot of the times in our clinical practices, those those data just live inside a proprietary device and it comes out in a PDF report that gets scanned into the EHR but doesn't exist as sort of a structured data element. When we do different, when we do like ETL processes for our EHRs to OMOP, anything that doesn't have kind of a target field in OMOP gets dropped. And so I think for ophthalmology, a lot of that data is lost. So these different EHRs that are getting mapped to OMOP and added to these databases, if that field for an ophthalmology specific data element doesn't have a mapping in OMOP, then it doesn't convey in that ETL process. So then we have to use kind of other proxies for phenotyping glaucoma progression. One that we've used is looking at need for surgery by looking at glaucoma procedure codes, but this is a very sort of rough proxy or surrogate, and it's not really, I would say, our standard of looking at glaucoma progression in ophthalmology clinical research, but it's the best we can do because that database doesn't include those data points that we need. So I think that's like just one example of where I think our ability to kind of more fully develop ophthalmology or ocular data element representation in OMOP will help facilitate some of that research, because right now we are fairly limited in a lot of the clinical phenotyping that we can do from those large databases that are mapped to OMOP. Outside of some like diagnosis codes and procedure codes and things like that, but really in terms of observations, it's fairly limited because of that, those gaps. I hope that helps.